as long as we breathe, as long as we move, we have a chance of staying healthy. We have a chance of, living a healthy, long life. And so it's when we start to become immobile, sedentary, and we stop breathing deeply that we can potentially have some health problems. We all are living an extremely stressful life right now, right? Since last March, especially. We've been locked up. We've been quarantined. We've been, our social lives have been curtailed. Um, I hope none of you have been sick, but some of us have been sick and had to deal with those kinds of things. And so when we're under stress like this, distress, it's a prime, our bodies are primed for other kinds of diseases and maladies. And so, you may be experiencing some mental health challenges, maybe some anxiety, depression. Maybe you are starting to feel some physical symptoms if you didn't before. And so, we really need to think about what ways can we combat these effects of stress on our bodies. And one of the ways we can do it is through movement, because movement gives us life. And as long as we're moving, we've got hope, moving and breathing. And so movement can take any number of forms. I've been forced to mostly work at home, these days, these last 9 or 10 months. Um, when we're in that kind of a situation, we're not at the office where we can walk around and see people and talk. You really have to make an effort to move. And so I faced that same challenge, as everybody else. Um, and so, two things we want to talk about today are the practice of yoga or just movement, because yoga is a type of movement. There are other kinds of movement like Somatics and Feldenkrais and Alexander Method and so on. And then there's actual exercise, cardio and resistance and weights and so on. But when we talk about yoga, a lot of people feel intimidated. They think I have to be young, I have to be flexible, I have to be skinny. I'm never going to be able to do it because I'm just not flexible enough. I'm not young enough, or I'm not skinny enough. And I'm here to tell you that those are all myths. That anybody can do yoga, and as long as you're breathing, you're actually doing yoga, because yoga is mostly breath work and with movement attached to it. And so when we talk about being present and connecting with your breath, we really are talking about taking very mindful breaths, which I'll practice here with you and show you what that feels like, and then doing movement that's purposeful. So, one of the major practices of yoga is ahimsa, or nonviolence. And, not only do, we practice nonviolence outside of our bodies, but within our bodies. We want to make sure that we are kind to our bodies and we think about ourselves with respect. And, instead of always thinking about our limitations and what we think we can't do, that we start to think about what can we do and what are we willing to take a chance to on doing. Um, and so if you have a yoga practice, you've probably already thought about these things, like how much should I do yoga? Like how many times a week? How many times a day? What should I wear? Should I eat or drink? And it's really very individual. Everybody's practice is your own. And if you're comparing yourself to others, you're doing yourself a disservice. So as you develop a yoga practice, you start to do some movement, it has to be right for you and it has to be right for your body. So you wear what feels good to you, something loose and comfortable. Maybe you practice yoga once or twice a week, even for 15 minutes or 20 minutes or something like that. Um, you choose the postures, especially if you're working with a teacher, then you have an opportunity to work with postures that really work well with your body. And there's always a way to modify a posture. So I promise you, if you go to a yoga class, you don't have to wrap your legs around your neck. You just absolutely don't have to do that. There's a way to modify every pose to make it accessible for most people. Um, how intensely you practice is up to you. Some days you might want to work a little harder. Other days you might want to be more restorative in nature and maybe take it a little bit easy. Um, One of the nice ways to get started with yoga, if you're at all hesitant or cautious about what you do with your body, is to take a chair yoga class. Some of us really do have physical limitations. Maybe you have bad knees and you just can't get down on all fours. Well, there's still a way to do the postures that you could do in that tabletop position. Maybe you can't, maybe it's difficult for you to get from the floor to standing and standing down to the floor. In our community, I'll tell you, I mean, this is not, an ad for these yoga studios, but my association is with Yoga Central and Yoga Place. If you're in the yoga community, Mike Curtis, those are the two studios that he has started. And I just feel I'm so grateful to be involved in that particular yoga community. We have a number of wonderful teachers who practice on the whole spectrum of yoga, from, working with people who are beginning, who have very serious physical limitations, all the way to those who are very accomplished Ashtanga practitioners. So that's really where you can find a wonderful place to start and to continue your yoga practice if you're interested in going to a studio. I offer my Saturday morning class by Zoom, so you could log in that way and do a Zoom class with us. So there are lots of options, and I know there are other studios in town that you may be familiar with. And so, find a place, find a teacher that you like to work with, and at least get started. Do something that'll help you. So if you want these slides, Julie can send them to you afterwards. This is a nice chair routine that you can do. That's included in the slides, but also, you can Google anything. So if you go online, you can find videos, and you can find, instructions that will help you if you're not working with a teacher, that will help you move through a practice. But if you're sitting in a chair right now, if you're sitting in a nice, comfortable chair that has a straight back to it, let me ask you to put your feet flat on the floor, and with a nice long spine, let the crown of your head reach for the sky. And I'd like you to be mindful for a moment here of how your body feels in this sitting position. If you're sitting on something really cushy, you might have a little difficulty, but you have to work a little harder to kind of straighten to lengthen your spine. But have your feet flat on the floor, and then just let your hands rest on your thighs. And just for a moment here, pay attention to where your body is. And let's start first with the hips. So are you kind of hunched over, and are you collapsing in the torso? If you are, lift your heart, lift your chest, lift it up high. Create some space between your ribs and your pelvis. And then think about where your shoulders are right now. We spend too much time sitting, right? Especially if we're working at home, we're sitting somewhere at our desk. Think about where your shoulders are right now. Are they all hunched up like this around your neck and your neck and your ears? If they are, roll them back and down and lift your neck up out of your shoulders a little bit. And then think about where your belly button is right now. So we want to engage our core. And so pull that belly button in towards your spine just a little bit, and you'll notice that you can sit upright a little bit better. And now that you're sitting more upright in your chair and the crown of your head is reaching upward, it lengthens your spine and gives your torso some space. All those organs in there, they're not intended to be all crunched up all the time. So creating space in your belly, space in your torso, gives your organs a little bit of breathing room, if you will. They get better circulation. And now let's think about our breath. And so as you sit here, close your eyes for a moment and just pay attention to your breathing. And are you feeling your breath mostly in your chest? Or are you feeling it fill your lungs and letting your diaphragm drop down and your belly pops out? So chest breathing versus belly breathing. We want to get to the point where we're belly breathing. And so bring a nice deep inhalation in through your nose and let it go past your chest. Let your heart center, your chest lift up. Let the breath fill your lungs, and then let your diaphragm drop down and your belly puff out. Take a nice deep breath. And just for a moment, allow a little rest, and then exhale either through your nose or through your mouth. When you exhale, though, keep that lift in your chest. Keep it high. Keep it lofty. Keep the space there. And take another breath in. And this time, in addition to feeling your belly breath, your belly pooch out a little bit, feel the breath go into your side ribs. And if you can, feel it go into your back ribs. You know, opera singers, you know why they stand kind of like this? Because that helps them to open up their back ribs. We have more capacity for breath in our backs than we do in our chests. And so when you see Luciano Pavarotti taking a nice deep breath, you know, he had his suits special made. They had to be made bigger in the back because when he breathed, you know, everything just expanded so much. And so let's be opera singers when we're breathing here. Let's feel that breath kind of go into our backs as well. So take another couple of nice deep belly breaths. Really feel as the inhalation comes in, expand your lungs, your diaphragm drops down, belly puffs out, ribs expand. We feel it in the back as well. And then let your exhalation be a little bit longer than your inhalation. Now, I don't know any of you, I don't know many of you personally, I don't know your physical situation. So if I ask you to do anything that is contraindicated by a medical condition you have or any other limitation, don't do it. You don't have to do it just because I asked you to do it. You have to listen to your body. All right, come back, open your eyes. Now, you know, we breathe unconsciously, right? We don't pay attention to it. You go to sleep at night, you're breathing all night long. You're probably not realizing it. You wake up in the morning, you take a breath, and you go about your day. So when we talk about being present with your breath, what we really mean is paying attention to the breath coming in and the breath leaving. And honestly, I just did a session with the Youth Leadership Academy the other day, and one of the things I told them was, you know, you can't think and feel at the same time. So when you're feeling anxious and you're feeling depressed, and you know you feel like you just need to relax a little bit, if you can be conscious of your breath and conscious of what's going on in your body, those anxiety feelings, frustrations, and whatever else that's not serving you just kind of goes by the wayside for a moment. So anytime you need to kind of come back to yourself, just concentrate on your breath for a little bit. So one of the things you can do is as you become conscious of your breath is you can do it with your eyes closed or your eyes open, is to just allow yourself 5 breaths and breathe in deeply through your nose and exhale through your nose. And then the last few breaths that you take, exhale through your mouth and then go back to exhaling through your nose. So just try that breathing pattern and see how that works for you. Some of the things that you can do from a chair, we do this from a seated position or we, you know, on the floor, or we can do, so twisting is good. Twisting, one of the ways you can do it from a chair is to start with that upright torso, crown of your head reaching for the sky. And as you take we would do this from seated on the floor or from a chair, inhaling your arms up and lifting your heart center, creating the space here. And then as you exhale, let's say we're going to twist to the right. As you exhale, you start your twist. Your left hand goes on top of your right knee. Your right hand goes behind you. And you just let your belly go first and then your chest. And if your neck allows, you can look out over your shoulder. So when you're seated a long time, just a couple of upright breaths and a couple of twists will be good for you. And then exhale, come back to center. And then always do the other side. Inhale the arms up. And then exhale, twist to the left. Your right hand goes on your left knee. Your belly twists first, and then your chest. And if your neck allows, look out over your left shoulder. And then exhale back to center. Now you can, while you're twisted, you can take a couple of breaths in your twist. What's good about that is it may feel like you can't take a deep breath, but you actually can. When all of our soft tissue, from organs to fascia to muscle to, you know, anything, ligament, when we constrict it in a twist, it flushes the blood and the fluids out of it. And then when we come out of our twist, we create more space for more circulation, more oxygenation. And so that's what helps to keep our tissue healthy, is this pulsating of eliminating, flushing out the fluids and then letting them come back in. It's part of what massage does as well, which I'll explain to you a little bit later. So twisting, you can do your cat-cow breathing if you're used to doing that on your hands and knees, where you lift your chin, lift your tail, and then you tuck and then you arch. You can do it seated in a chair. So you can see there's modifications for everything if you have any limitations that prevent you from being on the floor to do this. You can do our warrior poses. You can do any of the standing poses with assistance from a chair, or your blocks, or any other kinds of modifications that you use. So within the slides here, there are some ideas about how you might put together a chair practice that would work for you if the floor is not available. Any questions on yoga or movement? So I know some of you are home, some of you might be at your offices. There's another type of movement that I like to use in both in my yoga classes and in my therapy practice, and it's called Hana somatics. One of the movements that is especially helpful for everyone, no matter what your situation or your condition is a full body movement where, and I'll have to describe it to you. I don't have a video of it. But it's really easy to do. And if you're at home and you want to get down on the floor and lie on your back, that's fine. Go ahead and do it. But in order to do this movement, we would lie on our backs and our arms would be out in T position and our knees are bent with our feet on the floor. So you got bent knees and arms out in T position. And then you start by letting your knees go from side to side, like windshield wipers. Okay? And your feet are about a hip width apart. And then after you do this for a little bit with your feet a hip width apart, you move your feet a mat width apart. And you do the same thing with your knees. And you feel the difference. So I always recommend that you do the 2-foot positions. Now, while your legs are going side to side, you're going to rotate your head opposite your knees, side to side. So what you're getting here is a movement in every vertebra in your spine. The facet joints are moving. You're getting a really nice side-to-side movement. This is very good for the neck, especially if you're tight. And then once you get your neck and your knees and your legs going, then your arms are out in T position. One palm is up, one palm is down. Okay? Down on the floor. So you have to be real coordinated to get all this going at the same time. So you got your knees going side to side, your head's going side to side, and then you're going to rotate at the shoulder to shift the palms, okay? So we don't want to just flip our hand. So we want to rotate at the shoulder to flip the palms. This is both a calming and an energizing movement for the nervous system. Very calming if you're feeling stressed or anxious, you can't sleep, whatever. But it's also energizing in the sense that everything is moving. Your whole spine is moving. Your major joints, your hips, your shoulders, they're all moving. Your wrists. And so it's a wonderful Hana somatic movement if you don't do anything else during a day. It's a wonderful way to start and end your day. Now, when we talk about massage, there's lots of different kinds of body work out there. The main thing you want is someone who is licensed. In the state of Ohio, we're licensed by the medical board. It means we've taken a board exam, we've undergone training, at an accredited program. And don't ever be afraid to ask somebody about their credentials. We are proud of our credentials and we're happy to tell you. because, sometimes in spas and beauty shops, they have estheticians that do some, a little bit of massage, but it's not therapeutic in nature. So you have to decide what you want and need, and just make sure that, you're getting a qualified professional. And so there's general massage, what sometimes is called Swedish massage. There is a deep soft tissue work. I practice the St. John method of neuromuscular therapy. There's an awesome therapist in town who does what we call structural integration, or rolfing. So there are lots of people in our area. We've got a lot of excellent qualified therapists. Two of my friends do a beautiful job with craniosacral work. So, you can always find someone that can help you with your body work needs. Um, and so, what you want to look for is, someone that you've got, just like your yoga teacher. When you meet up with the right yoga teacher, you found your place. In all my years of practicing yoga, I've probably only had two teachers that I couldn't connect with, and so I just kind of took other classes. Most of us are, really try to find a way to make our classes accessible to everybody. Same thing with massage. It, even if you've never had a professional massage, what do you do when you bump your arm? Don't you rub it right away? Because that kind of a movement, that kind of emotion helps to take away pain. It restores circulation and lymphatic flow, and that's what promotes healing. So you might hear, different kinds of terms: body work, massage, somatic work. They all typically refer to the same thing. You know the song, what is it, hip bones connected to the leg bone and all that? You can see everything is connected here. What is happening in your feet, guaranteed is affecting your pelvis, guaranteed is affecting your atlas and your axis, and how your head sits on top of your body. So if anybody tells you that, it doesn't have anything to do with your neck or back pain, I say get another opinion, because there are some things, if you're not in alignment, if you have postural distortion, and we all do, those things are each is going to impact the other. How do you like my He-Man here with all these muscles? So you can see, bones, muscles. I mean, everything is connected by fascia, if nothing else. Okay, fascia goes all through your body. There are layers of it. It's connecting everything. And so, and that's why something like structural integration, it's really painful. It goes really deep, but that's what it's designed to do, is get to the deepest layers of your fascia and mobilize you again. And so, you may just want better range of motion. You may just feel stiff and tight, or you may be in a lot of pain, and you may have had an accident years ago, and then pain has kind of compounded over years. It's just important that you find the right kind of therapist to help you with what's going on in your body. And, most of my friends that, our circle of practitioners, we refer to each other. So if somebody needs something that I can't do for them, I know 2 or 3 other people that could potentially help them. And that's what you want, is you want a community of practitioners that are going to be looking out for in your best interests. And that's what we try to do, is to make sure you get to the right person, the right place, and get the help that you need. You see all those organs in there. When you're all scrunched up in your seated position, guess what's happening to them? They're not getting circulation. They're not happy. You might experience constipation. You might, experience other kinds of digestive issues and so on. So we've got to stand up. We have to breathe. We have to move. And we have to sometimes help our body with manual manipulation, like a massage treatment. Any of you ever feel like this guy with the foot on his head when you have a head? Yeah. Okay. So you have a headache or whatever. I mean, honestly, don't ever discount the value of soft tissue work. If you've never tried it, or if it's been a long time since you've seen a therapist, give it a try. You'll be amazed with the kinds of results that you get. And then there's lots of research on the effects of touch. I mean, from infants that aren't thriving to, people with mental health issues and, um, burn victims. I mean, over my 30 some years of practicing, I mean, I've seen all of these kinds of conditions. And whether I've been the practitioner or somebody else has been the practitioner, we all see positive results. Now, can you get rid of a lot of stuff through massage? Are things going to go away? Not necessarily. But your body work can help it be manageable. Sometimes it can make it almost go away. But there are times when you just need an intervention that's going to help you manage whatever it is that's going on with your body. So there are lots of techniques, but we all are very careful to practice within our scope of practice. So massage therapists do not do bone manipulations. Okay. Now that doesn't mean if I'm, that you might not hear a little creak or something might, pop back into place if I'm working on your shoulders and you suddenly feel, that your shoulders are feeling better. You get a little snap, crackle, pop there. But the attention is on the soft tissue, not on adjustment of the bones of the skeletal system. So you want to make sure you have a therapist that is working within his or her scope of practice as well. Some folks work without lubrication, others work with it. When you get structural integration, there won't be any lubrication. He will work directly on your skin into your soft tissues. Most of the rest of us use some kind of a light lubrication so that we have some glide on your skin as we're working on you. If you've ever been to a spa and you had that hot stone treatment, that feels pretty good. There are lots of therapists who incorporate that into their practices. You can see the chair massage. So, you don't always have to take all your clothes off. We can do some work through your clothes as well. If you've never been to a massage therapist before, it's important to know what to expect. These are just some examples of the kinds of practices you might see as you go looking for a therapist. Um, but typically, you'll be asked to disrobe to a certain degree and maybe keep your underwear on or whatever. If you are uncomfortable with that, there certainly are ways that we can work on you when you're totally covered up and when you have some clothes on. But for a full body massage, you would expect to have, from toes to nose, as we say. Um, but if you're going for some localized deep tissue work, it probably won't be a full body massage. If you've got pain in your hip, the therapist will work with the hip and probably the leg and maybe some into the back, to kind of focus on the area where you're having some issues. And so I don't want to read these slides to you, but one of the most important things is that you communicate with the therapist. If there's anything that is feeling like it's not quite right to you, or especially if it's helping you, we need that kind of feedback too, to say, oh yeah, that's right, exactly where the pain is, then we know that's where we need to go. But if you have discomfort, make sure you communicate it. Also, if you have any allergies, to any kinds of creams or oils or scents or fragrances, anything like that, that's important for us to know. We always have a bottle of jojoba oil that we can use on people with really serious allergies, because that's the least allergenic oil. It's the closest you can get to your skin's own sebum. So jojoba oil is very good to use on your skin. Typically, the session is an hour. When you go for structural integration, it's usually about 90 minutes. And if it's your first time, ask questions before you go. And don't be afraid to ask, so that you know what to expect. And you can enjoy your treatment much more when you feel comfortable getting on the table. In terms of fees, they vary. Usually right now, probably the fee for body work is between around $75. For the structural integration, because it's a longer treatment, the fee is greater. Sometimes your insurance may cover it. I am always able to get reimbursement out of my flexible spending. When I go for my treatments, I ask for a receipt. I get reimbursed that way. So there may be ways that you can get reimbursement for your body work therapy. And a lot of folks consider it a wellness necessity, and they budget for it. So A lot of people ask, should they tip? You know, my philosophy is I am a healthcare practitioner. I'm licensed by the medical board. I don't expect a tip. In beauty salons and spas, they have different expectations. So, you know, you should just, if you want to be clear about that, you can discuss that with your therapist. My fee is my fee, you know, as would be your doctors or your chiropractors or your physical therapists. So these are kind of things that we talked about here. Again, finding qualified therapists, just like finding a qualified yoga teacher, is really important. Don't hesitate to ask. We all should be licensed by the medical board, carry liability insurance, belong to a professional organization, and you know, and so we'll be happy to tell you about those and about our continued training. Some of the professional associations you might see in their credentials: AMTA, American Massage Therapy Association, etc. So, bottom line, before we do a little bit more movement here, is stay mobile, keep moving. That will keep you strong. That will keep your circulation going. That will promote health. It doesn't mean it's going to take every disease and every ache and pain you have away, but it's your best way to control whether your body stays moving. And my mantra is move the 3 B's: your breath and your body, and don't forget your bowels. But I'm not here to talk about that today. Don't get constipated. Seriously, I can't stress that enough. If you're breathing, if you're moving your body and you're moving your bowels, you should be in pretty decent shape, you know, to handle the kinds of things that come to you.